This European Society of Cardiology meeting was interesting in the field of interventional cardiology because quite exciting data have been presented in the different Hotline sessions. The first study which was interesting in our point of view was the CIRCUS trial that was conducted in France. It's a multi-center randomized trial that compared the effect of a bolus of cyclosporin in anterior STMI and investigated if this drug could influence the clinical outcome as well as the left ventricle remodeling following the angioplasty. And there was a large study including more than 400 patients, and we were a little disappointed because there was no difference in the two groups, the placebo versus the cyclosporine group, regarding the primary endpoint that was a mix of clinical endpoints such as death and rehospitalization for heart failure, as well as left ventricle remodeling index. And the rationale of the study was that you could prevent the reperfusion injury related to STMI PCI by using cyclosporine, which is a pharmacological agent that could block the mitochondrial transition pore. And we were quite confident in this study because we had previously published data supporting this hypothesis, but unfortunately in this case there were absolutely no difference at all between groups. And the conclusion is, of course, the reperfusion injury is still a big concern for interventional cardiologists, but obviously this cyclosporine injection does not prevent that complication. The second and the third studies that were interesting to us were presented this afternoon in the Hotline sessions, and they were about bioresorbable vascular scaffold. This new generation of, we could not say stent, but at least scaffold. The first one was a TROFI II trial conducted by Patrick Serrais, and that compared BVS and a second generation eluting stent, the XIENCE stent, in patients with STMI. And so that was a kind of small, it was a small study, around 90 patients in each arm, and the primary endpoint was to compare the healing process by OCT intravascular imaging in patients treated by BVS or by everolimus-eluting stent. And the study confirmed that the healing process was slightly better in patients treated by BVS. Of course, we are now seeking for the clinical data because it was just a first analysis at 6 months, and maybe that this delay is a little too short to see and to understand all the potential benefit of the BVS. And but so far, the clinical outcome were quite comparable between two groups, which is a good thing. Regarding the third study, it was once again about BVS. It was that were the results of the ABSORB Japan trial that compared BVS versus everolimus-eluting stent in patients with two vessel disease and stable or NSTME lesions. The authors compared the clinical outcome at 12 months and the angiographic outcome at 13 months. And once again, they observed no difference in terms of clinical outcomes, suggesting that BVS are as good as this second generation drug-eluting stent, and angiographic data were quite comparable, once again suggesting that we have at least these BVS are behaving the same way as the best drug-eluting stent that we have so far.